Weaker, it's disorganized.
It's weaker.
Painful.
That's the main point why I mentioned type 3, but it is also disorganized. So that's the second point that I make. So number one, type 3 collagen starts off 30% weaker than type 1 collagen. And second, it's disorganized. So when the body produces it, it produces it like this. And it's important.
Also more painful, right?
It is. We're getting to it. You're jumping ahead. So we're just doing this slower and more structured. So I go through each one because each one is devastating all by itself. So, thanks. So we've got this crappy, well, this type 3 collagen going in like this. And honestly, I like to use red when I draw it. If you can at all, red, but it's not that critical. Okay, so your body makes this type 3 collagen, and the big difference is type 3 collagen is 30% weaker to begin with, but it's the poor organization that really makes it weak. Type 1 collagen in your ligaments and discs is all lined up the same way, and it pulls together. So you can stretch it really hard without any damage or any irritation to it. Type 3 collagen, when it's tangled, as you pull it even gently, little pieces start to pop. And when they tear, it triggers inflammation. And this is where you have to personalize it. John, remember how you told me when you go to work every day, it hurts. Well, what you're doing when you're working, those normal everyday activities are tearing or re-tearing the weak type 3 collagen, not the healthy stuff, the weak stuff. And that's why at the end of every day, your pain is worse. Or when you wake up in the morning, your pain is worse because you've torn those fibers, and we have to stop doing that. Okay. Questions about that? See how I personalize it. I make sure they understand, because even though you explain what's going on, this is what's happening in your back, literally the 90% of the time, the patients don't understand. You're talking about this is why your back hurts. So you're connecting the dots. You never assume that the patient can keep up with you. So you make it blatantly obvious about what's wrong. All right. So you've got this type 3 collagen. Basically, because it's poorly organized, it decreases the overall strength. It's not as strong. This healthy stuff is strong as steel. And I like to explain to them, on a scale of 1 to 10, this poorly organized collagen is only 10%, 20%, or maybe 30% as strong as the original. If it's left like this, and it's in that early stages, okay? Second problem is it's got poor flexibility. Again, I'd make this question, and Jane, do you think this is as flexible as the original? No. And the flexibility is really poor. So we have decreased flexibility. Any questions about those two problems? Jane, can you see how, because you have all this scar tissue in your back, that's why for the last 5 years, you've had ongoing issues with back problems, because your back has all this scar tissue in it, and it's not as strong and not as flexible. This is why, Jane, when you pick up your baby, you tear it sometimes, triggering your the spasms in your back and the problems in your back. All right. The third problem, and I like drawing the arrows because this arrow makes it really easy. There's 2 negatives, or there's 2 down arrows and 2 upward arrows. It's a good visual. The second is it has increased number of nerves. A healthy disc, a healthy ligament, a healthy tendon has almost no nerves in it, very few. It has a few nerves in the sheath, but as your body produces type 3 collagen, it adds nerve endings to it. More nerves means what, Jane? More pain, right? They always say more pain. The other problem is, and then again, I just explained the concept, but they're not going to get it. So I go, so remember, Jane, every time you hurt your back, you barely pick up your child, and yet you have severe pain. That's because of all the times you've hurt in the past, your body kept adding nerves. And that's why, Jane, your condition has gotten worse over time, because your body keeps adding more and more nerves to the area. Make sense? The fourth problem is what we call hypersensitive. These nerves become tangled in the scar tissue. And that means normal everyday activities, as you move and it stretches, it binds to those nerves, triggering pain. Jane, this is why your body aches all the time. This is why you ache when you're sleeping. And that you remember you told me you have sharp episodes of pain, but even when you're not doing anything, it hurts. Or maybe it doesn't hurt when you're resting, but every time you go to move, you can feel the stiffness and the achiness. That's the scar tissue rubbing on those nerves or pinching those nerves as you move. Any questions about that, Jane? So you guys saw I personalized every single one, if I can. And that shows them not only that this creates enormous, it's very convincing. So you could even end it with, Jane, do you see how this scar tissue is the root cause of your problem? Every symptom you gave me, I just related back to one of the 4 negatives of scar tissue. And so at this point, you're very convincing. In other words, the trust level. No, and a lot of times what the patient will say, if you do this right, is they'll say, man, this explains every symptom I have. No one's ever explained this to me like that before. This makes a lot of sense. In other words, I like to say they're 100% on board usually at this point. Like, no one's ever done this. I'm absolutely convinced scar tissue is the heart and soul of my problem. So that's how you know you're doing your job right. When they're nodding their head going, wow, this, yeah, okay. And they may know this, but no one explained it that simply and that clearly to them. So at this point, you want them 100% on board. If they have any questions, if they look at you confused, don't move on. Keep explaining till they nod their head and go, okay, Dr. Opdahl, I get it. I have scar tissue. My problem's scar tissue. I want them annoyed. Move on. You guys should be going, all right, we get it, Dr. Opdahl. Move on. You want them slightly annoyed at this. Man, okay, I'm joking, but I'm exaggerating. All right. Any questions about this?
I have a quick question about just the timing. So how long typically is a day 2 appointment?
It should be, 15 to 20 minutes.
So we book them like on the half hour and have about 15, 20 minutes to talk, deal with questions, and then move on.
Trying to keep it, if you don't want to take too long, I keep explaining things to you guys, but I can do this fairly quickly by being very accurate, quick, and I'm watching the patient. They got it, move on. They got it, move on. They got it, move on. And it depends on how prepared you are. If you go in there and you can't remember what you did on day 1, this actually takes a little bit of practice to do, to where you keep the patient's key symptoms in your mind. And this is not like the scripting that I've learned with other practitioners where they say, you say the same thing to every single patient. You have a set script where you're talking about, Saboe will know this, where they talk about subluxations and pinched nerves. And this is, yes, some of this is very scripted out and is going to be identical and it's going to get boring and tedious. The thing that keeps it fresh is I have to link these 4 things to that patient's specific symptoms and problems.
Yeah, that's the key.
And that takes a little bit of practice. It's a muscle. Once you do it 3 or 4 times, as I'm doing the exam on day 1, I actually start making mental notes. Okay, remember that for tomorrow. Remember that for tomorrow. Remember that for tomorrow, because that's the one I'm going to relate back to the patient. And if you're not used to doing that, you're going to have to put it in the notes that night. That's why when I do my chart notes, of course, I do my chart notes so I don't get audited by the state board or by insurance companies. But my chart notes, other than that, are scribbling notes to remind myself, don't forget tomorrow, you're going to talk about how she keeps hurting her shoulder when she's delivering mail. You're making all those mental notes to connect them here. That's the personalized part. Okay. Good question. Any other questions?
And just one more is, do I also, so I'll do an assessment, an orthopedic assessment to just confirm a diagnosis on day 1, maybe do an ultrasound, or potentially do the ultrasound on day 2 is what it sounds like. Are those also back to back? So like if they came in on Monday, they'd be back in on Tuesday?
Yes. always back to back.
Okay.
Time is very important. Remember, time kills all deals. So, and any gapping, anything else that have, we want day 1, day 2, day 3, day 4, everything right in a row.
And so if we were going to end up doing Prolo or PRP with them, would we then have them back for a third day?
Well, they're not, remember, they are not going to do Prolo or PRP until they agree to a treatment program.
Right.
So that would be on a date. Chris, yours is going to be a little bit tougher. We don't have it nearly as refined. So there will be times where you do a day 1 and they come in, especially if they're doing a PRP program, a chiropractor is managing the case. So if the chiropractor sends them over and says, hey, they got a bulging disc with some arthritis and I want PRP for the arthritis, you're going to look at the x-rays, you're going to do your own assessment, you're going to do, look for any counter indications. And the general golden rule is, as long as there's nothing wrong with it, because that's what the chiropractor is going, I want to do this. Chris, or, are you on board? Is there any reason not to? Or did I miss something? Is there anything else? And you'll say, they'll come in, you'll assess them. And then you'll say, yeah, there's no reason we can't do this. I think it'd help. And then you send it back to the chiropractor and that's it. The chiropractor will put together the program with Colton kind of coordinating. And then the next time you see them is when they show up to do the PRP. So does that make sense?
That does make sense. I just kind of wanted to get an idea of what patient care looked like from assessment to treatment in that regard, sticking a needle in their facet joint and seeing.
Needle would not. The needle typically won't get placed unless the only time I've seen it is if it's a PI. So if there's no financial obligation on the patient's end, so if they're a PI or workers' comp, you can do it sooner, but typically it's not until the 4th appointment the patient makes is usually the first visit where they'll do a PRP or Prolo.
Okay. That sounds good. And just so you guys know, it looks like we have a countdown of about 8 minutes remaining on the Zoom meeting. Yeah. Not that I'm just letting you know we may get cut off.
Awesome. Thank you.
Yeah. Okay, good question. And so sometimes you're going to have a day 1 and then the second visit, you're going to close them on a program. You're not going to do a test run, or on their day 1, you did a test run. So really, you've got to be a lot more nimble, and we're going to have to spend a little bit more time understanding these steps so we can modify them based on the patient's condition and their need. Day 1, you may have done the ultrasound already. You already may have a treatment plan for day 2, and you sit them down and go, all right, here's what's wrong, and you got to do this on day 2. And that's a big negative because this is all new information that they've never heard before, and you're explaining it to them, and then you close them when they haven't had time to process information. We want them, Dr. Saboe, you have a huge advantage in that you present this information to them, they go home and they process it, then they come back on day 3 and you regurgitate it again to them, but you review it with them, and it fills in a few more gaps and they get more comfortable with it. And then on a day 4, they're sick of this stuff. They're like, this stuff, they can repeat it back to you if you did it right. Do treatment based on inflammation only. And I say it like this. Jane, do you have any questions about the 3 phases? Because I review it. Day 4 is, any questions about the inflammatory phase, the repair phase, the remodel phase? I think I've explained those in great detail. And they go, oh yeah, Dr. Opdahl, you explained it really good. Thank you. Now, Jane, I need to understand, are you interested in just getting treatment for some of my patients, they just want me to treat them in the inflammatory phase. Other patients say, no, help me get through the repair phase. That's 70% of the healing. I want your help with the repair phase. And then some patients say, this is my back. I want you to help me with all of it. I want you to get me as healed as you possibly can, Dr. Opdahl. Jane, which one do you want? Are you interested in just pain relief or some rehab or the whole shebang, everything? And at this
that's what I'm saying is that a treatment plan is not going to be the same to get them through inflammation than it is to get them through all 3, right?
So you're correct. So there are actually 3 treatment programs.
And different ways to pay for it.
Huh?
Different options to pay for it.
there's really, even though I'm presenting 3 options, there's only one and I'm recommending the repair phase. So if they say, Dr. Saboe, I just want pain relief. I don't want your help repairing this. It's going to be hard to say because you basically explained why they're going to die and fall apart and be a mess if they don't rehab it properly. And you're the only one who can rehab it properly. And they're rejecting you. And they say, Dr. Saboe, I just want help with the inflammatory phase. I don't want help rehabbing it. They're rejecting you. They're rejecting 90. And at that point you go, okay, so you just want help with pain relief. And they go, yes. And so you look at them and you go, okay, so we're going to treat you every single day until you feel better. And then you're done. You tell me when you're done. And so, you can just pay as you go. Or you could say, I think you're going to need, we've already treated you. This is your 4th of treatment and you're 80% better. I think you're going to need 3 more treatments. And they go, okay. And that's what you do.